Hi all, this is your Dr. Mommy. In today's video, we'll be talking about headache during pregnancy. So headache in a normal person, we can take a paracetamol or any other tablet so that it will settle down. Whereas in pregnancy, mothers will be confused because they'll be worried about each and every tablet's effect on the growing baby. So headache, first of all, let us see what are the causes. Headache happens because of various reasons. First thing, during the first trimester, the first 3 months, early pregnancy, headache is a little common because of hormone imbalance and things like that. Second reason can be hunger-induced headache. That is, when you don't eat in time. Because now, when a lady becomes pregnant, her intake of food should increase. Basically, her calorie intake should increase. Whenever there is this calorie deficit and the lady doesn't eat in time or the quantity is less, then it will lead to hunger-induced headache. Third thing can be stress-induced headache. So stress-induced headache, what happens whenever you worry a little or anything is working in your mind, so that also leads to headache. So how you can get out of the stress-induced headache is listen to a calm music, okay? Avoid taking stress, okay? Anything can be solved, you try to solve it, otherwise leave it. Don't worry and brood over things that you cannot correct. Fourth thing could be the worst outcome, PIH, pregnancy-induced hypertension. So what happens earlier, when a lady is normal, her BP would have been fine. But during pregnancy, sometimes in some mothers, we see a spike in the BP. Okay, so this is called pregnancy-induced hypertension. So if this is the cause, the earliest symptom the mother will come to us is with headache. So what you will have to do is don't neglect your headache. So apply a balm or something. If your headache doesn't come down, better consult the nearest doctor so that you will get your BP checked, your vitals assessed, so that we will know the cause of the headache. And the fifth thing here will be pituitary adenomas. What happens in the brain? There is one gland called pituitary gland. So whenever because of hormone imbalance, it is seen in few cases, we observe this. So the gland increases in size and leads to compression of the optic nerves and the other structures. So this is a little rare, but this also has to be taken into consideration. When this happens also, there will be headache. But if it is pituitary adenoma related headache, then it will lead to a little bit of blurring of vision. Of course, blurring of vision will be seen in PIH, that is pregnancy-induced hypertension, eclampsia and everything also. But still, this should not be neglected. So whenever you have headache and blurring of vision, you will have to visit your doctor immediately. The last cause is migraine also. Migraine sometimes triggers or increases during pregnancy. I don't say it's a last cause, but still this is one of the causes. So migraine is one of the causes for headache. So how to avoid migraine is avoid any bright light, any loud noises, which will trigger headache to you. Rest well, eat in time. So all these will bring down the headache if it is during migraine. So the question that mother asks me is, can I take one paracetamol or ibuprofen, a painkiller to bring down my pain? So it depends on what trimester you are. See, basically during first and second trimester, we don't entertain mothers taking these painkillers because definitely it will have its effects on the baby, which we will be discussing in the upcoming videos. But you can first apply a balm, drink lots of water, eat in time, rest well. Still doesn't come down, take 1 cup of hot coffee. So caffeine will to some extent bring down the headache. If it is not coming down, then visit the nearest doctor, we'll see what is the cause and then treat you accordingly. So this is to tell you all about headache during pregnancy, which is very, very common. I hope you like this video. Please like, share and subscribe to my YouTube channel, Dr. Mommy's Happy Home. Bye-bye.